Welcome back to Meds Made Easy. My name is Tarun. Today we're going to be talking about Metronidazole, also known as Flagyl. It's an antibiotic. It's used for a lot of different things, anything from bone and joint infections to sepsis, central nervous system infections, endocarditis, any gynecological infections, lower respiratory infections. So yeah, again, going through it would just be difficult. It just depends on what you got and whether the doctor thinks this is appropriate for you to take. I've seen it as combo therapy for other infections, so this can be one of two antibiotics you take to kind of kill what you got going on. It pretty much undoes the DNA of the bacteria. That's how it kills it. It just goes in and, if you've ever seen what a DNA looks like, it's a double helix strand. It goes in and just kind of rips it apart and it kills it that way. Generally you want to take it with food because it is harsh on the stomach. Again, antibiotics kill not just bad bacteria, but they kill good bacteria as well in your system, right? So your not your stomach, but your intestines technically have good bacteria in them, which allow you to break down food and things like that. And so this goes in and kills everything. It'll kill the bad, it kills the good, which is why your doctors might tell you to take a probiotic with it, or eat some yogurt while you're on like a 10-day, 14-day, 28-course day of antibiotics, just to keep your system balanced out. Generally after a dose, it peaks, meaning the peak effect is felt in about 1 to 2 hours. I've seen this thing dosed once a day, twice a day, and up to 3 times a day. It just depends on what you got, so I don't want to go over the dosing of it. If you are lactating, there is something called a relative infant dose. And so as long as you're under that relative infant dose level, it is safe for babies to get this in the breast milk. But if there's too much of it in the milk, that can cause unwanted side effects to the baby. So you have to be monitoring your breast milk if you're on it. In pregnancy, so in the first trimester, there have been known to have cases of like cleft palates. So again, if you need to be on this medication, make sure that your OBGYN knows. Don't go to an emergency room, get this medication, and you didn't let the ER doctor know that you're pregnant, and you get put on this medication because that could lead to harm to your baby. We don't want that, right? So, and then if you have renal or liver issues, you're generally safe to take this medication, but always make sure that you're letting your doctors know everything that you're on so that we make sure that you don't harm yourself in any way. Too many medications stacked on each other can stress your kidneys, can stress your liver. It's just not cool. So here's a list of side effects here. Of course, the main ones with antibiotics happens to be GI-related issues. It can cause diarrhea, constipation, abdominal cramping, and pain that gets really bad. And if it is, call your doctor, let them know. We need to switch you on to something else. The other big thing with this one is do not take any sort of alcohol at all with this medication. It will cause you to, this is a true story, projectile vomit. I've seen it. It happens. And you have to warn everybody because everyone still on the weekends wants to go out drinking even though they're on antibiotics. And while most antibiotics you shouldn't drink because it inhibits the effectiveness of the medication, people do it, and I'm not going to lie, I've done it on occasion as well, and you shouldn't. But this medication, you cannot do it. It will cause you to puke. It will literally cause a severe reaction in your body that makes you feel like complete crud, and I have even seen projectile vomiting on this medication before. Very, very severe. Watch out for it. That's the biggest little tidbit I can tell you about this medication that other pharmacists might not. They might forget. So don't drink on this, guys. Leave any comments, concerns down below. Hit subscribe on the channel. Let us know how we're doing. We'll see you next time on Meds Made Easy. Bye.